month, and various breast health awareness programs are being conducted across the globe, as well as in India also. Now so much of awareness is being conducted. So since 1985, this October month is meant to educate the public and promote the screening and prevention of breast cancer. So why we are giving so much of importance to this breast cancer? Because it is the leading cancer, or most common cancer all over the world, and not only in India. So that's why the awareness programs are very, very important. And the various events which are we are organizing just to educate the women about their own breast health, because it's very, very important for the women to know about their own breast health. And unless and until they know about their own breast health, it is they won't be able to spot out if there are any changes which are happening. And the shyness which are having in the females, that they should come out of it. And sharing is very important, and reporting to the doctors is very, very important. And that's why these programs are very important, so that the awareness can be created and the females can spot the changes at an early stage. Because everybody know that early detection is as good as complete cure in the case of breast cancer. Nowadays so many advanced modality of managements are there. So if it's a stage 1 or 2 cancer, there is almost 100% cure. And hence there is a small effort from our institute, that is All India Institute of Medical Sciences, Mangalagiri, to create the awareness regarding this commonest cancer that we are getting in females. So our eminent faculties, Dr. Naresh Kumar, he will be speaking on epidemiology and etiology of breast cancer. Dr. Pavitra will be speaking on breast self-examination, and Dr. Hemanth Kumar will be speaking on screening in the breast cancer. So over to you, ma'am, for further proceedings.
Thank you, Dr. Meenakshi. A very good introduction, but that every one of us should realize that breast cancer is most common cancer among women, and it is easily treatable if it's detected early. That is what we all should understand. The purpose of today's meeting is also how to detect it in early stages and how to get it treated. Instead of getting panicked by the word cancer, how to get it treated. So now we'll go to the next part. Dr. Naresh Kumar will be speaking on epidemiology and etiology of the breast cancer, and he is additional professor in Department of General Surgery and at All India Medical Institute, Mangalagiri. And he was educated from Kasturba Medical College, Manipal Academy of Higher Education, Mangalore. And he did his MS General Surgery, Kasturba Medical College, Manipal, Mangalore. And he is 16 years of experience in general and laparoscopic surgeries. He is academician cum clinician with interest in medical education, diabetic food, endoscopy, laparoscopy, thyroid and breast diseases. Published several research papers in indexed journals. And over to you, Dr. Naresh Kumar, and welcome to this program.
Thank you very much, madam, for those kind words of. Shall I share my screen now?
Yes.
Just give me a minute, madam. I'm just trying to.
No problem. While the talks are going on, all the participants, whatever doubts you have, please write it on a paper so that you won't forget. At the end of the session, you can ask those questions. Please, Dr. Naresh Kumar.
Yes, madam.
Screen is
Very good afternoon to all the members who have come here today to listen to us. And this month being a very special month for breast cancer awareness, which is being celebrated as a breast cancer awareness month across the globe, internationally, to spread the most important message of breast cancer awareness and breast cancer, prevention. I mean, breast cancer, when detected early, is as good as a patient who is he can live as well as a patient who is as a normal women in this world, right? So without wasting much time, I would just want to emphasize in today's webinar that what are the various statistics that we have today as far as breast cancer is concerned across the globe, and why we are celebrating this breast cancer month. It's an important month for spreading the awareness of cancer, and what are the various risk factors that are responsible for development of carcinoma breast. Now, if you look at this month, this has been a month where across the country, across the world, people celebrate this, and it is also an important month where a lot of activities in terms of breast cancer awareness, in terms of the message that we're going to spread to all the women in this planet. So why this month? This month has been chosen as an international health campaign to increase the awareness of carcinoma breast amongst women, and to also to educate women about early screening and the early treatment that is available today in our paradigm. And also to promote,
online class.
I request all of you to please, there is some noise from the background. Request all of you to please mute yourself. Thank you. The goals or the purpose of celebrating this breast cancer awareness month is to educate people about the importance of early screening and treatment. And another important thing is to provide information about screening mammogram, which has become a very big boon to especially detect early cancers, and also to support those people who are cancer survivors or those people who are affected by breast cancer. And there are a lot of activities in terms of the organization. There are several organizations across the world who are trying to pull up a lot of funds, mainly to push a lot of funds into the research of to identify, to detect or prevent and treatment and so on and so forth. So this month essentially is a very important month. That is the reason why we are here today celebrating this month of breast cancer awareness month. And if you look at this picture very closely, breast cancer is, if you look at in any other international podiums or international forum, you would see this female carrying the pink ribbon. So that is the sign of the breast cancer awareness program across the world. And why this pink ribbon? So there is a small anecdote which I would like to share with you all. It is the story of a Charlotte Healy, who was a lady in the US. She lived in California, and she was one of the survivors of carcinoma breast. And at that point of time, somewhere in 1930s and 40s, she felt that there's not much of funds being pushed into carcinoma breast care, prevention, and treatment in the US. And she wanted to propagate this message to the administrators and also the bureaucrats, saying that there needs to be more amount of funds to be channelized for breast cancer research and breast cancer treatment. And she went propagating this, and she had a silent protest, wearing this pink ribbon, and saying that there needs to be more enthusiasm from the governmental organizations, the bureaucracy, and other things, so that they keep putting a lot of funds into it to improve the patient care and improve the quality of treatment, and to improve the detection rates of carcinoma breast. So this was recognized by one of the magazines which were working very closely with Charlotte Healy. It's called the Self magazine, and they actually propagated and they used this pink ribbon as the international symbol of breast cancer awareness and breast cancer promotion in the year 1992. And if you look at a lot of events that are happening during this month, like people do walkathons, people illuminate the buildings with pink light to just to symbolize the awareness of cancer, breast cancer. Now, getting into the subject proper, breast cancer, the burden of the disease globally is one of the most common cancer diagnosed in women, and it accounts for almost 23% of all cancers in women globally, and it is the second most common cause of death in women. So there's a huge threat in this breast cancer, because many women, especially during their younger age, are dying because of carcinoma breast. So that is something, is a cause of concern, and it's a huge threat. And if you look at the difference in the cancer survival rates across the continents, you would see that there is a better 5-year survival in developed nations when compared to developing countries like us. In developed nations, the survival is as close to 80%, and in developed countries, it is a very dismal figure of less than 40%. And the reason why this is there, I will just tell you in the next few slides. And it is also predicted that the global prevalence of breast cancer will cross 2 million by the year 2020, and which would have significant contributions from developing nations. And in 2012, there was 1.67 million new cases of breast cancer, which was diagnosed, and it accounts to about 25% of all the cancers among women. And this is the data that we have today, which is called the Globocan. 2020 has put up the data showing the number of new cases which was detected in both sexes in all ages in 2020. If you look at the chart, the pink shaded is the incidence of breast cancer, which is as close to as 11.7%. That means it is one of the major components of all the cancers across all ages and in both the sex. And if you look at the number of new cases among women, all ages, it is about 24.5% when you compare it with all the other cancers that we commonly see. This I will just skip. And if you look at the mortality rate, as far as the data that comes from Globocan, is as close to as 13.6%, which is a huge number, and second most common killer after carcinoma lung. And coming to Indian data, of course, Indian data also has the same kind of picture, more or less. If you look at that, the number of new cases detected in 2020 is as close to 26.3%. And if you look at the mortality is the number one killer in India, which is around 13%. And there are a lot of other data which is coming from National Cancer Registry Program, which is taken up the job of data retrieval and database. So from here also we have a lot of data saying that the incidence of breast cancer tops most of the cancers, and the mortality among cancer is also breast cancer. This is the report of the National Cancer Registry Program 2020. It was released in August 2018, and it says that cancer of breast and cervix were the most common cancers in women, and the highest burden of cancer breast was observed in most of the metro cities. Again, underline most of the metro cities. Now, going back to the question, why there is a difference in the survival compared to developed nations and developing countries like us. There are a lot of factors being involved in this, and I'll discuss each one of them. And what are the first thing? Low level of awareness. See, the moment the awareness is there, so they know they should report to the healthcare facility. If there are certain changes or subtle changes, if the women are able to recognize and identify, they will be able to report to the healthcare facility much early in the disease. Much early in the disease. That is what has happened in developed nations. So we are lacking behind in this aspect because the level of awareness is not penetrated to the length and breadth of this nation. So I only wish that each one of us spread this awareness to reach every single woman of this country so that they know about the breast and breast-related diseases, so that they know what are the changes that are happening in their breast, and to report if there are any abnormalities to the healthcare facility as early as possible. Because the moment we detect these disease, that breast cancer in a very early stage, the cure rate is almost very, very good, and the prognosis is excellent. So they can live like any other women in this country. The other reasons are delay in presentation and diagnosis. Because of the kind of, as Madam has already told, because of the shyness or because of the stigma, they don't want to be examined, nor they want to be screened. So that would actually delay the presentation and would result in an late stage disease. They would rather present to us at a very late stage where things are not so amicable, things would not be under control. So that is another reason why we are having a poor figures as far as the survival is concerned. And the third thing is incomplete treatment, because nowadays we are talking about not a single treatment, we are talking about multiple treatments for carcinoma breast. It is not just surgery, it is various other options which actually have to fight together, like chemotherapy, hormonal therapy, radiotherapy. So all of them are acting in tandem to fight this disease. So people at some point of their treatment, or some point of their follow-up, they feel that it is not good to go for this treatment. They are feeling they're feeling terrible going to chemotherapy or radiotherapy. So they discontinue the treatment. They're not compliant to their treatment. So what happens? The disease is half cured, or disease is not fully taken care of in terms of the bioburden or disease burden is concerned. And in our country, there is limited access to very effective treatment. So when I mean a multidisciplinary team or a multidisciplinary treatment, it is not that it is available in all parts of the country. So it's it is available in cities, it is available in tertiary care centers. Of course, in secondary and the primary level, it is not available. And the access also is quite limited for patients to get their tertiary treatment. That is another reason. In developed countries, the survival is very good. They have a very improved survival rates. The reason because they have very widespread awareness mechanism in place, where every woman of the country know about their breast and diseases, so that they report very early in the disease. And there is extensive screening mechanisms also in place, where screening mammogram is being done. I think Dr. Hemanth will cover that screening mammogram later. And it's a real big boon, because these are the modalities which will pick up tumors much early in their disease, even before even before a lump develops, or even before a lady could feel something. A mammogram would have picked up smaller lesions which are not palpable or which are not identifiable. So that is the importance of screening mammogram. So, and they also have very easy access to effective treatment, because their system has in place. They have a lot of things where each of the specialities are developed in different areas where people have good access to effective treatment. Now, what are the risk factors why people develop breast cancer? So it could be divided into broad categories like age. Females are very high risk of developing breast cancer because of the large breast and the denser breast. And of course, it's not that males do not develop carcinoma breast. There are incidents of males also developing carcinoma breast, but the incidence is much lesser than compared to females. And there are other risk factors like family risk factors, or people who have a strong family history of carcinoma breast, or especially the maternal side. The mother had a breast cancer, or a sister had a breast cancer, or a maternal aunt having a breast cancer. The risk is very high in such a population of people. And there are various other genetic risk factors, and there are some genetic risk factors, like we call them as the BRCA genes. So these genes are the ones which are responsible, BRCA1 and the BRCA2 are the ones which are responsible for carcinoma breast. And so risk factors could broadly be classified into ones that are modifiable, and the ones that are non-modifiable. So when I mean modified, it can be controlled, or it is under our purview that we can modify this risk factor. And there are certain other risk factors which cannot be modified, which we do not have any control over such risk factors. For example, that risk factors which cannot be modified are increasing age. People age, so we cannot have any control. But the problem with carcinoma breast is not that the aged people develop carcinoma breast. It is the younger people also, especially the women in the reproductive age group, are the ones which are highly vulnerable to develop carcinoma breast. That's because there's something called the estrogenic state. The hyperestrogenic state is the one which is a real threat and a risk factor for development of carcinoma breast. And people who attain menarche at the very early age at menarche, when they attain menarche at very early age, and older age at menopause. So these are the people who have a very long reproductive age group. They are, and each time they are very highly vulnerable to develop carcinoma breast because they're exposed to very high levels of estrogen each time during their cycles. And nulliparity, people who have not conceived in their lifetime, they are the people who are at very high risk of developing carcinoma breast because entire life they are they are exposed to estrogen for a continuous long periods of time. And the family history of breast cancer, again, I told you that BRCA1, BRCA2 mutation carriers, these are the people who has a very, very high risk of developing carcinoma breast, which cannot be modified. So race, there are certain people like the race, ethnicity. White women have got a very high risk of developing carcinoma breast. And those people who have been subjected to some form of radiations in their childhood, especially for treating other malignancies like lymphoma, leukemias. So when they are exposed to radiation also increases the risk of developing carcinoma breast. Those risk factors which actually can be modified. So one is the age at first full-term pregnancy. If the women conceives before the age of 30 years and it's a full-term pregnancy, they are highly protected against carcinoma breast. Parity, pregnancy itself is a protective factor, remember. Pregnancy itself is a protective factor because that time the levels of estrogen are dead low and they are protected. And similarly, the breastfeeding, the longer duration of breastfeeding, the greater is the protection from carcinoma breast. Obesity, people who are obese, very high risk of developing carcinoma breast because of the estrogen factor. People who consume alcohol, again, increases the risk of carcinoma breast. Smoking, history of smoking will increase the risk of carcinoma breast. Use of hormone replacement therapy, especially postmenopausal, people take hormones, especially exogenous estrogen preparations. So they are the people who are at high risk of developing carcinoma breast again. Now, if you look at what has happened over a period of decades, there are a lot of changes that have happened as far as the science is concerned, the biology of the tumor, the understanding of the breast carcinogenesis, and there is a huge shift in both the diagnostics as well as the treatment modalities that we see today. And today we are talking about picking the tumors much early in the disease because early detection gives best cure rates and also improves the survival. So it is our duty that we pick the tumor much, much early in the disease so that we have a whole list of armamentarium that with us where we can target these carcinoma cells and give them a very good cure rates. And now I'm just showing you few slides where these are some of the people who have contributed a lot towards understanding of the disease, treatment, and and here is one person, Stewart Halstead, who did a lot of work on carcinoma breast, and he did several radical procedures. Earlier days in way back in early 90s, 1900s. So people used to do radical mastectomy. That means the whole breast, the entire chest wall muscles, and and the axilla used to be cleared. So these are not being done because we have come a long way, and there are a lot of research that has happened in the area of breast cancer, where now we are talking about breast conservative surgery, where if you pick the tumor much early in the disease, so we can offer them breast conservation, which I mean, you can just take off the lump with a good margin, but still retain the breast, because which is a huge psychological advantage for women having retained the breast, at the same time having taken care of the malignancy. So that is the stage at which we are in today, because thanks to all the efforts by these gentlemen and various others, which I have not posted here, because of their research, today we're bearing the fruit of these researches. And today we can very well clearly say that you pick the tumor much early, you can give a very good survival, you can give good prognosis, at the same time retain the breast after treatment also. And the mantra that I always keep saying, that the 4 P's, that is, you propagate the knowledge about breast and breast diseases to every woman in this country and this world, so that they are aware about their breast and their breast abnormalities, or any subtle changes that they notice during their entire reproductive or even during their entire lifetime. And to promote breast self-examination, which Dr. Pavitra will be talking about in a short time now. So they will be, if they are taught about how to do the breast self-examination, it becomes a part of their journey, where they will understand how to do this breast self-examination, because breast self-examination would increase the incidence of picking up even tiny lesions that they may notice every month during their menstrual cycle. And once they know, they are aware about the breast diseases and they are able to identify any change in the breast, they must have this prompt reporting of breast symptoms to the healthcare provider. And in the healthcare setting, we will be doing a thorough clinical examination, and we will also subject them to screening mammogram at our facility. So if there is a suspicion of malignancy, or if there is any lesions which you think that needs to be screened, so we will subject them to screening mammogram. And nowadays, of course, even mammogram. Sorry. The mammograms, of course, these days, even we do mammograms which are called as the opportunistic screening mammograms, where we will we suggest that every woman beyond 45 years of age must undergo a screening mammogram, either on their birthday or their anniversary or something like that. They can fix a date and just go and take a mammogram and see what is the current status of their breast, and the architecture and other things of the breast can be easily seen on a mammogram. So these are the things that we must be able to sensitize all women across this country. So what ultimately we're going to achieve is early detection offers very good prognosis. So that is what is very important. Thank you, and Jai Hind.
Thank you, Dr. Naresh Kumar. It's a wonderful introduction to the breast cancer scenario. And every one of us, he stressed the point, early detection, awareness. These are the most important points. Early detection, early treatment, then survival rate is very high. What we are seeing in today's practice, all of our practices, they come in stage 3, stage 4, like that. So we are unable to help them. The mortality is very high because of it. I always tell my patients, breast cancer is the best cancer. Because if you catch that cancer early, it can be cured. You are sure to live a long, normal life. So it is very important for all of us to remember that. Then let us move on to the next session. Please close your screen, Dr. Naresh.
Yes, madam.
The next session is self-examination by Dr. Pavitra. She is assistant professor in Department of General Surgery at AIIMS Mangalagiri. She completed her post-graduation from AIIMS New Delhi. and her interest is breast oncology and minimally invasive gastrointestinal surgery. Welcome, Dr. Pavitra.
Thank you, ma'am, for the kind introduction. I would be talking about breast self-examination. As you guys already know, Dr. Naresh Kumar has given a brief introduction about the burden of breast cancer, which is there throughout the world and more so in the developing countries because of lack of awareness and lack of early detection. Early detection will not only improve the survival. Because of early detection, we can minimize the surgeries. As we know, breast conservation surgeries, all these things can be done if the tumor is small, if it's an early stage. So it can give good quality of life, good survival, prolonged life. Patient can live, years together and die of natural causes if it's detected early, not because of breast cancer. And even the treatments, whatever we were talking about, chemotherapies, radiotherapies, all those things can be minimized if it can be detected early. So everything is not so bleak. There is a lot of hope. And when we are talking about a developing country like ours, we talk about all these screenings, mammograms, so many other tests which are involved, which might be a bit difficult considering 70% of the population is rural population with limited resources. So what is the best tool? The best tool I would say for a country like ours is breast self-examination. Teaching each and every woman to do a breast self-examination early in the age, starting at around 20-25 years of age, so that it becomes a ritual and a woman will learn how to examine the breast herself, sitting at her home without having to go anywhere, without having to spend a single rupee on anything, and still be able to detect the breast cancer early so that she can get a good treatment. So breast cancer is the biggest tool if used properly, especially in a country like India. So let's go ahead and see how do we do breast self-examination. Okay, this we already know that survival rate is much bad in India. This is mainly because of lack of early detection rather than because of lack of proper treatment. Treatment can still be done. There are still facilities. Many things have been improved over the decades, but the main hurdle is not having early detection. Patient presenting late to us. So what are the first, we'll be talking about what are the signs of the breast cancer, and we'll teach you how to detect these signs on yourself by examining yourself every month. Okay. So the main thing everybody knows, there's a lump anywhere, it could be cancerous anywhere in the body. It could be cancerous. It's not like each and every lump is cancerous. It could be cancerous. So the lump can be seen in the breast or axilla, what we call as our armpit. Any changes in the size and shape of the breast. When you compare breast from one to another, if a breast is being exposed to a disease, then the other, when you compare it to the other breast, the opposite breast, it can look a bit different. Skin changes and nipple changes. Usually these happens in a later stage. Best thing is to detect when it is in the lump stage. So risk factors has already been explained, so I'll not go into it. Okay, the biggest hope we have is early detection. And for early detection, the simplest tool which can be used, which can be propagated is breast self-examination. So let's quickly go into how to do a breast self-examination. So when we are doing breast self-examination, there are two components. We stand in front of a mirror and we look for all these changes. Okay, whatever changes are there, we note it down compared to the last month. And other than that, we'll have to use your hands and palpate, feel the breast. You feel the breast and see if there are any changes which has happened in between the last month and this month examination. So you see and you feel. There are two components to it. So stand in front of the breast and in front of the mirror and check both the breasts. So you compare the breast, one breast to the other breast. That is the best comparison you can get, because each lady's breast will be different, size will be different, shape will be different. So if one breast is affected, it will change from the other breast. So what are changes can happen? Size can be increased. One breast can be larger than the other breast. Shape can change. There can be some bulging, which you can see where there is an underlying lump. Any lumps, superficial lumps, especially deep-seated lumps, we cannot make out. Superficial lumps, you can make out as lumps being seen. Any skin changes, usually skin can become thickened at one particular point, or it can look different, slightly different from the other regions. Change, dimpling of the skin. Whenever there is a swelling, there can be dimpling of the skin, which will look like an orange peel. Like you see an orange from outside, you can start looking like that.
Please mute yourself, please.
There can be redness of the skin of the breast. Any dimpling of the skin. Wherever there is a lump, sometimes the skin will get attached to the lump and it will get pulled inside. You can see a small pit forming around the at the region of the lump. And next we'll look for the changes in the nipple. Okay, any changes in the nipple, any rash, any scaliness, all these things can start happening around nipple and around the black skin around it, what we call as areola. And the nipple can be suddenly pulled inside. If this some ladies have nipple being pulled inside from childhood, that is not an indicator of cancer. If it has started recent onset, it has started recently, then that could be an indicator of there is some underlying lump which is pulling the nipple inside. When we have to squeeze the nipple, or spontaneously also, sometimes there can be some discharge from the nipple. That means whatever may be the nature of the nipple discharge, it can be bloody, sometimes it can be whitish or like milk-like kind of discharge, even when patient is not lactating. Some yellowish or serous kind of discharge. Any whatever be the nature of the discharge, color of the discharge, you have to just note it down. What is the kind of discharge you are getting? Then actually when we are standing in front of the mirror, especially in a bulky woman, you can't notice the entire breast. The lower part of the breast, especially in old women and in bulky breast, you cannot see the lower part. So you continue standing and lift your hands up. And then you notice the lower part of the breast. Okay, lower part, same changes. Whatever we have discussed till now, same changes. If there is, it's seen in the lower part of the breast, you have to look for it. Then we'll feel the breast. Now we have seen if there is any changes, but not all changes can be picked up by looking at the breast, because the breast is a large tissue. Something which is there deeper cannot be seen. So we'll have to feel for it. So for that, it's better when you lie down, the breast distributes evenly and it's easier to feel. You feel for any lump. See, how is this technique? We feel for lump. Usually women feel their breast in between fingers. If this is done, every breast feels lumpy. Every breast feels lumpy because of the fat and tissue inside it. So we have to use the opposite hand. First thing, for right breast, you use left hand. For left breast, you use the right hand. And next is technique. How to do it? You have to keep the flat of the other hand, not like this. You should not feel in between fingers. If this is the breast, you have to use the flat of the hand and just rotate. When you rotate, if there is some lump, it will roll in between your fingers. So this is the way you have to feel your breast if there's any lump. So when you're feeling, especially in a large breast, you have to make sure you're feeling entirety of the breast. For that, we can use some of the techniques written over here. either one of the shape. It doesn't matter which one you are using. This is just to make sure that you feel the breast in entirety. So you use some pattern. You can come from outside inwards, outside inwards, outside inwards. Okay, or you can start in one place from outside towards the nipple and the next place like this, or you can go all around. From outside, you are going in a circular motion to inside. This is just to make sure you examine each and every part of your breast so that you don't miss, you don't, in a large breast, especially when you're feeling somewhere, you might forget you have not felt in that place. So if you follow this systematic method, you can feel the entire breast. After this, you have to move towards your armpit and examine the armpit also, because there can be some lumps felt in the armpit. Armpit should not be forgotten. So the same thing we repeat on the opposite breast. You can stand up and repeat the same things, because certain places, especially upper part of the breast, will be felt better while standing up, or lower part will be felt better while lying down. So it's better to repeat both times. This can even be done in your shower. Some women, if they don't have privacy, they can't stand in front of the mirror, if they don't have a separate private room where they can do all these things, it can be done in a shower. That is the best place, because your breast will be wet. You will not feel a lot of pain. The water acts as lubricant. It's very easy to do all these things when a patient is taking bath. And patient will have a lot of privacy while doing all these things. Don't have to feel shy. Don't have to have a separate place for all these things. So it can be done while taking bath. So the next thing is, if I've told whatever symptoms I have told are symptoms of cancer, but it's not seen only in cancer. So whenever you see something like this, you feel a lump, you see any of these changes, does not mean you have cancer. Please don't diagnose yourself as having cancer. Please do not panic. Okay. So what you have to do if you find any of these things? If you find any of these things, please consult a nearest doctor, a surgeon if possible. Otherwise, any doctor would do. You please consult them. Even a doctor will not be able to tell you whether it's cancer or not just by looking at it. So there are certain tests which we might have to do. First thing, what will the doctor do? Doctor will just examine you similar to what you had examined. Doctor will try to feel the lump, see how is the lump, size of the lump and all those things. After that, we'll get some imaging, some scanning. Either it can be your normal routine scan, what we do for your abdomen can be done on your chest, or they can do a mammogram based on your age. This will be decided which diagnostic imaging they choose. After that, if there is some suspicion in this lump, then they'll go ahead and do a small biopsy or a nail test, what we call as FNAC. After all these three tests only, it can be decided whether it is cancer or not cancer. So please do not panic. Almost 80 to 90% of the lumps in the breast, especially in younger women, are not malignant. So many women, we see what they do, they'll feel the lump, they panic and they do not come to hospital thinking it is malignancy, that you might have to do surgeries, you might have to do chemotherapies, and they'll start postponing coming to hospital just because of that fear. So please do not fear. Whatever you find, you come to the doctor and get it confirmed. Not all lumps are cancerous. Okay. So if everything is all right, you're not feeling anything that month, what do? Ritualistically, you have to do this examination every month. So when do we do this examination? If a person is menstruating, so best to do after a week or 10 days after menstruation, because all of us know during menstruation, the breast feels a bit tender. It's a bit difficult to palpate. So if it's painful, you will not be able to feel it very deeply and in a proper way. So leave some 10 days after your menstruation and do it. If you're not menstruating, your menstrual cycles have stopped, have a particular day in the month, maybe 1st of a month or 5th of a month or something like that, and do it on that particular day. So what I want to take home message, each and every one of us will give you the same take home message is, Early detection gives you best survival. Early detection is almost like a cure in breast cancer. So all you have to do, you don't have to say, even if it's a rural woman, uneducated woman, who doesn't have any resources, who doesn't have any money, who can't come to a doctor if a clinic or a doctor is far off, not accessible. Anybody can do this. So we just like you to spread this information. We have one small video based on the same presentation I have prepared. I'll just share with you that video. It's a 4 minutes video, and the same video is available on YouTube. So if you have to educate, one second. If you have to educate any of your friends, family, near and dear ones, you can give them the YouTube link. Now everybody, even in a rural area, has a phone with internet connection. So that can be used for something useful. And this video is available in 3 languages. I'll show you the link of the YouTube video also after I finish this video. So it's available in Telugu, English and Hindi, all 3 languages in our AIIMS YouTube channel. So just a quick video.
Breast self-examination. Approximately.
Is there any sound, Dr. Pavitra?
You're not able to hear, ma'am?
No.
Oh, then I think there is, it's not getting transmitted. Then I will show the link on the YouTube, ma'am. That would be better.
Yeah.
We can watch from there. I thought the volume is coming. So this is the YouTube AIIMS Mangalgiri channel. Okay, if you go to AIIMS Mangalgiri, just search AIIMS Mangalgiri. Go to the videos. These are the first few videos you can see of the breast self-examination. It's available in Telugu, it's available in English and as well as Hindi. So everybody, entire India, whoever can access these videos, show it to anybody, just share the link. Please spread this word. It's a very small thing which we can do, but it can save somebody's life. So I would like to stop my presentation with that note. Thank you for this opportunity to present it, ma'am.
Thank you so much, Dr. Pavitra. It's a very crucial point you have spoken about self-examination. Please note down the link, that is AIIMS Mangalagiri. Telugu is also there. Kushal program people from Vizag, please download that.
Okay, madam.
So that you can show it to the people, women there.
Okay, madam.
Okay. So next we'll be going to the next part of our program. Yeah, this is screening in breast cancer. Now we have seen how to self-examine. Now it is screening in breast cancer. What else can be done? So this will be dealt by Dr. Hemanth Singh. Welcome, sir. And Assistant Professor Surgical Oncology, AIIMS Mangalagiri. Completed MCH from Tata Memorial Hospital, largest cancer center in the country. All of us know Tata Memorial. And his areas of interest are breast oncology, gynec oncology, thoracic and GI oncology. Welcome to the program. Dr. Over to Dr. Hemanth Kumar.
Thank you for the kind words, ma'am. I would start with the presentation and thank you for this great opportunity. I'll share my screen.
Your screen is visible.
Okay, ma'am. So the first thing is that don't get scared listening to all the data that that's so many cancers are there, people are dying. So don't worry about all that. Okay, so just will teach you some important practical points which you can carry home and learn it and practice it. Okay, so whenever you're talking about any oncology screening programs or anything, these are the two most important buzzwords that everyone is talking. What is screening and what is a mammogram? Okay, so let us come to the word screening first. It means to tell that screening means that we are trying to identify a particular problem in a person who is not complaining of anything. That means this individual is a completely healthy one, not the one with a problem. Say you want to screen a person for diabetes. So we do a simple test called check a random blood sugar, and that will tell us whether the patient is diabetic or not. Similarly, if you want to detect whether this patient has breast cancer or not, we can do some screening test which will help us in identifying whether that particular problem is present or not. Okay, and the second buzzword which I spoke to you is a mammogram. Mammogram is something like a simple X-ray of the breast. I think everyone would have seen that an orthopedician takes the X-ray of the hand or the leg to detect a fracture. Similarly, a simple X-ray of the breast can be taken to find out that if there is any problem or not. Okay. Now we all are doing screening or doing a mammogram, trying to do one simple thing, and that is we have the opportunity to detect the cancer at an earlier stage when it is completely curable. Now, what all are the tools for detecting the breast cancer? So the first one, as Dr. Pavitra has already mentioned about breast self-examination. So as the word says, it is done by the person himself. And the second one is clinical breast examination. This is done by the doctor in the clinic. Okay, so as the word says, breast self-examination and clinical breast examination. So you can see in this diagram that here the individual is examining her breast, and similarly here a doctor is evaluating the patient or the individual. Okay, and the third one, as I already mentioned, is the simple X-ray of the breast, which we call technically as a mammogram. Okay, so this is a lady who is undergoing a screening mammogram as recommended by a doctor. So now if a person comes to us, so the most often they are examined in the clinic, and most often the doctors do a clinical breast examination to find out if there is a problem or not, and mammogram is done, and this is the most effective way of detecting breast cancer. Okay, detect a problem at an early stage. No one there is one very important point about breast cancer that you all have to understand, that out of many hundred types of cancers which are present in the human body, only few of the cancers can be detected early. Okay, and fewer of these can be cured, and breast cancer is one such cancer that you can detect it early, plus you can cure them early. Okay, so in spite of being the most common cancer in the country and the most common cancer in the world, easily be detected by screening tools, which some of which you has been already taught to you. Okay. So breast cancer is one such cancer. So it's a good thing actually that it can be screened and cured. Now my question is, now a person comes to the clinic and says that now I think I might have a breast cancer. Now, when do you start screening individuals for finding out that he is having cancer or not? So one philosophy which is so simple and easy is that majority of the breast cancers are detected when the person is in 50s and 60s. So can you all see this curve? In the earlier years of life, around 35 to 40, there is very less chance that the patient is going to have breast cancer. Now, can you all see this, how the graph is rising as the age is rising up to 74 or 79? So the chances of the breast cancer are detected are quite high. So we start at the age of 40 years. So once you have attained the 40 years, you have become eligible for getting a screening mammogram to find out if you are having any problem in the breast or not. So we start at the age of 40. So philosophy behind this I've mentioned already. Okay. Now my question is that how frequently? Now you might think I am 42 years old. I got the mammogram done last year. Now should I get it done now or after a few years or after 5 years? That is the question. So it is recommended that every year it needs to be done. Okay. Clinical checkup and mammogram, which is a simple X-ray of the breast. Now, if you can see this diagram, the first mammogram was done in 2019. So the next mammogram will be done in 2020. So once every year, you have to have a clinical checkup with a physician and a mammogram, which is the X-ray of the breast. Now you see that this is once a year, but you're doing breast self-examination every month. So we are having 12 checkups which are done by yourself, plus another checkup which is done by clinician, plus a mammogram which is being done. So almost 13 for 14 times a breast is evaluated for a problem. So if there is any problem, it can be detected at a very early stage. Now the question is that I am 45. I've got it screened, but my mother-in-law is 72 years old, 74 years old. Should I get her also screened? What if she gets breast cancer, which is late? So this is the question. So like, should we screen elderly or not? So the answer is yes. So we do not have a upper age limit for screening for breast cancer. So we do it as long as the woman stays in good health. That means to tell, if your grandma is healthy, she's walking about, doing puja or doing her regular activities, that means it is good enough that you need to screen even elderly for finding out if they have any cancer or not. Okay. Now the whole idea of a screening mammogram or a breast self-examination is to detect when the tumor is small. Okay. Now can you all see this diagram on the right upper side where the tumor is approximately 2 centimeters and the one tumor on the lower part is around 5 centimeters. Now there is no question about this, that the tumor on the top is going to do better because it is smaller. Less aggressive treatment is needed, and there's more chances that the person who is having a tumor in the top upper portion will be cured compared to this person. Okay, so this is the entire idea of this having a program, is that we detect the problem when it is really small. Now, as it has already been mentioned that that there is no more research in any other cancer compared to breast cancer. Every year a new molecule is being invented, or like many new treatment modalities are coming up for, like for breast cancer, and chemotherapies are more and more targeted. There are less side effects. There are modern ways of delivering RT, and the reconstruction of breast has also evolved in the big way in the last 15 years, and also the acceptance. So this has changed completely the outlook of breast cancer, which was 20 years ago. Now, take home message is very simple. So these are the 5-6 points which we all want you all to practice. That if you are more than 40 years old, please get annual clinical breast self examination and a mammogram. Do monthly breast self examination, okay, and do the mammogram every year. If you find a problem, please see your nearest doctor and pass this message to the near and dear ones. So the message is breast cancer is curable if we detect it early.
Thank you very much, Dr. Hemanth Kumar. It's a very concise and very clear message is given to all of them. Now the floor is open for discussion. Any question and answers? Please, questions are there. Unmute yourself and ask the question. The panel is ready to answer.
Good evening, ma'am.
Yes.
This is Kondalra, Chief Engineer Public Health, retired. And we are associated with a NGO, World of Healthcare, which is working on cancer prevention particularly, and creating awareness among the citizens and others. So what can be our role regarding this prevention of cancer particularly, and in creating awareness? Can you please guide us?
Dr. Naresh Kumar, can you answer it? What is the role of people or NGOs who are working in increasing the awareness?
Madam, can you repeat that question? I couldn't hear that.
Sir, can you repeat the question?
Certainly. We are working on prevention of cancer, particularly creating awareness about healthcare and any screening tests, etc. So awareness of the necessity of screening, etc. And taking sufficient care that cancers do not occur. Their occurrence is minimized. So what can we do in this respect? So any suggestions or any guidance from your side?
Yes, sir. Yes, it's a nice question. This whole program was all about breast cancer awareness. So today we are confining to breast cancer, but of course there are several other cancers also where there are screening programs. But just to highlight the fact that screening is a very important tool, as Dr. Hemanth has already mentioned. It's a very good tool as far as carcinoma breast is concerned. So our only intention and our only wish is that every woman of this area, locality, country must be aware of this breast cancer, breast and breast diseases, and they must also seek help from a healthcare facility, whichever is the nearest healthcare facility, so that they can be screened further, they can be examined further, and so that we can proceed with the other aspects of screening and diagnosis later on. So first and foremost important thing is the knowledge about breast cancer. So we are, Dr. Pavitra has also shared that link, because today everybody is having an internet, access to internet. Everybody is having a phone with which supports the internet and Wi-Fi systems, where we can just float this message and also share this video, so that they are aware. Repeatedly they keep seeing this, they will keep doing this repeatedly. So as far as breast cancer is concerned, it is self-examination of the breast. They should be taught how to do a breast examination on their own. They should be doing it. So like every month during that, after their cycles, continuously throughout the year, and once in a year, a clinical examination by a specialist doctor or whoever is there in the locality. So that will increase the awareness. Plus, it will also, as far as the detection rate is concerned, it will increase the rate of detecting cancer. And when we pick them up very, very early in the disease, we can offer very good cure rates for such people. So our main focus would be is to spread this message as far and wide as possible. It will start from us. So we sensitize about 10 people, and those 10 people go and spread this message to another 100 people. So this is how the message today, spreading a message is not a difficult thing at all, because of the social media, because of the WhatsApp. So good things can be circulated in that way.
Thank you.
And as an NGO, I have a small suggestion. We should raise our voice to make the governments also to respond to such high incidence of cancer among women, especially breast cancer and cervix cancer. We should raise our voice as NGOs. It is our responsibility to produce some papers, research papers on these social issues of breast cancer and cancer among women. I think as you are working already in the field of cancer, you should keep writing articles on this. And also we should raise our voice to make more mammogram missions available at secondary healthcare centers, not only tertiary healthcare centers, but secondary healthcare centers also, so that more women can avail these mammograms.
Thank you.
Yes, any more questions, please? I have a question. How many mammograms are available for the people, for the women?
Dr. Hemanth?
Mammogram patients
Not clear,
are
ma'am.
really freely available?
Mammogram is available at most of the centers, ma'am. I think there must be more than 10 centers around Vijayawada or someone doing mammograms. So I think at least in all the tertiary care it is definitely there. Plus there are many private diagnostics also which provide the care.
Madam,
Yes, madam. Please go on.
మేడం అంటే డౌట్ ఏంటంటే మన అంటే ఇప్పుడు వన్స్ ఈ ప్రాబ్లం ఎంటర్ అయిన తర్వాత క్యాన్సర్ ట్రీట్మెంట్ అవ్వకపోతే లైఫ్ లైన్ ఏమైనా ఉంటుందా అనేది డౌట్ మేడం. అంటే
if cancer is diagnosed and treatment is not done, what are the chances of her survival?
మేడం క్యాన్సర్ డెవలప్ అయ్యి తెలిసాక ట్రీట్మెంట్ చేసుకోకపోతే అని అడుగుతున్నారా, లేకపోతే ట్రీట్మెంట్ లేకపోతే అని అడుగుతున్నారా?
అంటే తెలియకుండా ఉన్నారు మేడం వాళ్ళకి, అంటే వాళ్ళకి ఎంటర్ అయింది బాడీలోకి, బట్ వాళ్ళకి తెలుసుకోలేకపోయారు వాళ్ళకి ఉంది అనేది.
స్టేజ్ బట్టి పోతుంది మేడం. మనకి ఎన్ని రోజులు అయ్యింది ఆ గడ్డొచ్చి, స్టేజ్ ఏముంటుంది అంటే ఏమవుతుంది, క్యాన్సర్ అన్నప్పుడు రొమ్ములో ఉంటుంది, ఒక 1 సెంటీమీటర్ స్టేజ్ దాకా రొమ్ములో ఉంటుంది. దాని తర్వాత వేరే బాడీ పార్ట్స్ కి స్ప్రెడ్ అవటం స్టార్ట్ అవుతుంది. క్యాన్సర్ కణాలు చంకలోకి వేరే బాడీ పార్ట్స్ కి స్ప్రెడ్ అవటం స్టార్ట్ అవుతుంది. సో దాన్ని బట్టి మనం స్టేజ్ నిర్ధారణ చేస్తాం, కొన్ని టెస్టులు చేసి స్టేజ్ నిర్ధారణ చేస్తాం. చాలా చోట్లకి స్ప్రెడ్ అయిపోయి ఉంటే మరి మనం చేసేది ఏముండదు, క్యూర్ అన్నది ఏముండదు, జస్ట్ మనం వాళ్ళకి పెయిన్ అది రిలీఫ్ ఇవ్వగలుగుతాం అంతే.
ఓకే మేడం, థ్యాంక్ యూ మేడం.
Our main aim is now to detect cancer early, breast cancer early, so that we can give a quality of life for these women. That is the main aim. Let us all today talk about breast cancer, self-examination, how to detect it early, not to have any stigma or not to be afraid of the word cancer itself, and how to spread the word, spread the message. That is the main aim. I think knowledge is power. So let us give that power to the people so that they can detect breast cancer at early stages.
Madam,
Yes, madam. We are
I just
going
want
on.
to,
Continue, sir.
I just want to add that the fact that when we started breast screening and breast mammograms in our institute, we also started another program called the Integrated Breast Wellness Clinic Program. So, which has been very successfully been running in our department in the last couple of years, where we are getting many patients who are just dropping into the clinic, and we have a dedicated team who is doing this breast cancer awareness and how to do the breast cancer self-examination. So this program is a very big hit in our department. So it is so all patients can utilize these services. They can drop into our OPD anytime, irrespective of whether they have problems or not. So there is a team who will guide them, who will be talking about breast cancer. They'll be giving some information materials, education materials, and we already have that, and it is also there as a soft copy. So it is being running very successfully in our department. Thanks to our HOD and other team members for making this happen.
All India medical institutes have these wellness centers for screening of breast cancer.
Most of them are having, madam, but some of them are in the process of developing that integrated breast wellness clinics. So we are functioning through 6 days a week. With anytime the patient can just drop into our clinic, and mammogram facility has been there right from about 2 years back. Also, we started mammograms. It is there with us, and that AIIMS, AIIMS are also coming up in every state. Every state is going to have AIIMS, so that facility also will be a big boon to all the patients who are there in that particular state, where they can access to facilities like AIIMS.
What is the cost of mammogram in AIIMS?
It is
640.
640, madam.
640. Very reasonable, so that women can avail those services.
640 per year, that is. So if we are doing screening if we are doing in a year, so they may have to spend about 600 rupees for that.
Note down all the people who are participants, please note down that it is quite reasonably priced in the AIIMS. And also outside, I think it is around 3,000 to 4,000 mammogram, depending on 2D or 3D mammogram.
Madam.
Yes.
అంటే ఇప్పుడు అంటే అంత లో కాస్ట్ అమౌంట్ కూడా పెట్టని వాళ్ళు ఉంటారు కదా మేడం, హెల్త్ విషయంలో కొంతమంది లేడీస్. మరి అలాంటప్పుడు గవర్నమెంట్ హాస్పిటల్స్ ఏమైనా ఫ్రీగా మెమోగ్రమీ చేసే స్కోప్ ఏమైనా ఉందమ్మా?
గవర్నమెంట్ హాస్పిటల్స్ టెరిషరీ కేర్ అంటే పెద్ద హాస్పిటల్ ఉంటాయి కదా, ఆ హాస్పిటల్స్ అన్నిట్లో మ్యామోగ్రామ్ ఉంటుంది. కాకపోతే వాళ్ళు అపాయింట్మెంట్ ఇస్తారు, అపాయింట్మెంట్ బట్టి ఆ రోజు వెళ్ళి చేయించుకోవాలి.
ఓకే,
ఉందమ్మా మ్యామోగ్రామ్ అన్ని చోట్ల ఉంది, టెరిషరీ హాస్పిటల్స్ లో ఉంది.
ఓకే మేడం, థ్యాంక్ యూ మేడం.
Ma'am, just I must information like last there is some organization sir was telling about these units around all states. So what is that organization, madam, where this wellness centers we can check, we can go to?
These wellness centers are located in All India Medical Institute hospitals. 6 days a week they are running these wellness centers.
And this center is actually attached to our own department of surgery, madam. So it is a small wing which we have dedicated some space for integrated breast wellness clinic. So in our own department, that is. So in case they have some problems, quickly we will be seeing these patients. The moment they are screened and the moment they are counseled, and if there is any issue, immediately we are staying very close to that space. So we will be seeing these patients if there is any abnormality, or if we need them to be screened by screening mammogram. So all those things can be done in the same area that we have this clinic.
And the people there are equipped for counseling the patient to get rid of their apprehensions and all
Yes.
that.
Yes,
So
madam. Yes.
it's very important for them to go to these wellness centers.
Yeah.
Now, most of the big hospitals have wellness centers for different aspects of the diseases, like brain diseases, if anybody is having tumors or brain issues or hemiplegia, paralysis issues. They have wellness centers separately for that. Neurology department is having, like that, heart diseases, it's having its own wellness centers. So it's very important to use these centers. We should know that they are available so that people can use it. Counseling is also a major part in this.
2D mammograms to 3D mammograms, so ఏది ఎప్పుడు యూస్ చేయాలి మ్యామ్? ఫస్ట్
అవైలబిలిటీని బట్టి మనకు ఉండాలి కదా, అన్ని చోట్ల 3D ఉండదు, 2D ఎక్కువగా ఉంటూ ఉంటాయి. మనకి ఏది అవైలబుల్ గా ఉంటే అది
3Dనే చేయాలని ఏమి ఉండదు సార్. మనం నార్మల్ మ్యామోగ్రామ్ 2D మ్యామోగ్రామ్, ఎక్స్రే మ్యామోగ్రామ్ అయినా కూడా డిజిటల్ మ్యామోగ్రామ్ అని చెప్తారు, అది హైయర్ సెంటర్స్ లో ఉంటుంది. లేకపోయినా ఎక్స్రే మ్యామోగ్రామ్ చేయించుకున్నా పర్లేదు. 3Dనే చెయ్యాలి అన్నదేమి ఉండదు. 2D నార్మల్ ఎక్స్రే మ్యామోగ్రామ్ చేయించుకున్నా సరిపోతుంది.
థ్యాంక్ యూ.
Any more questions, please? So let us wind up. It's already 4:30. We are. It's very interesting topic. So everybody is staying with us. All the people. Nobody left the discussion. We are very happy to have you all, the panel of doctors from AIIMS Mangalagiri. Thank you so much for enlightening our communities about this. And across India, people logged in today because it is in English, not only from Andhra Pradesh or Vijayawada, across India, people logged in. So we are very thankful to all the participants. Please pass on this message to many more people so that our purpose is served. Many more people should be aware of these things. Just a few take-home messages. Every month, self-examination of the breast, and once in a while, a doctor should see the patient, and then once a year, above 40 years, every woman should undergo mammogram. So these are the few take-home messages. Early detection is the key for success of the treatment. And remember, breast cancer can be curable if detected early. So thank you so much. We are very thankful to all the team of doctors from All India Medical Institute Mangalagiri. And thank you to one and all for participating in this wonderful session. Thank you so much.
Thank you.
Thank you, madam.
Thank you, madam. Thank you. Thank you.
Thank you, ma'am.
Yes, sir.